So, good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor of Physiotherapy Department. So, today we'll discuss about fundamental starting positions. So, Sherrington stated that posture follows the movement like a shadow. Every movement begins in posture, ends in posture. Posture from which movement is initiated known as starting position, which may be active or passive. So, there are 5 fundamental positions, and all others are derived from them. So basically there are 5 types, that is standing, kneeling, sitting, lying and hanging. And stability and equilibrium is maintained by balance of forces acting on the body. And this when force of muscle contraction is used, the contraction is isometric. Strength distribution is normally controlled by reflexes known as postural reflexes. But during learning process of new pattern of posture, then voluntary effort is definitely required. So in standard, which is the most difficult fundamental position to maintain, the whole body is balanced, stabilized on the small base of support by coordinated work of many muscle groups. So heels are together, same line, toes slightly apart, knees together, straight, hip extended, rotated laterally, pelvis is balanced, spine stretched, vertex is thrust upward, ears are at level, eyes look straight forward, shoulder down and back, arm hang loosely to side and palm facing inward to the body. So basically the muscle work, there is intrinsic muscles of the foot stabilizing the feet and prevent the curling, and then flexors of interphalangeal joints, plantar flexors of the elbow, dorsiflexors of the ankle, everters, extensors of knee, extensors of hip, they all work to maintain hip extension, balance pelvis on the femur head. And then extensors of the spine work to keep the trunk upright, flexors of the lumbar spine, then prevertebral neck muscles, flexor extensor of Atlanta occipital joint, retractors of the scapula, and arms are relaxed. And all these muscle groups stabilize the body in anterior-posterior direction. And also there is balanced contraction of lateral muscle to maintain the footing. So what are the effects and uses? So basically, as the base of support is small, so COG is high. So the state of equilibrium is relatively less stable than in other fundamental position. So this is only suitable as a starting position for exercise, those who can maintain it correctly. So when the perfect balance is achieved, the muscle work is. So what are the right position of standing? Wing standing, low wing standing, bend standing, reach standing and yard standing. And by altering the leg and trunk, we can also do standing. Next we are having the kneeling. Body supported in knees which may be together, or lower leg rest on the floor, rest of the body is in standing. So flexor and extensor of knee work together, and extensor of hip and flexor of lumbar spine, they work strongly to maintain the angle of the pelvic tilt. So basically the COG is lower than in case of standing, so it is more stable, but it can be uncomfortable for some or most of the people, and usually used as a starting position for backward movement in sciatic pain to take control of hip joint, lower trunk and preparation for standing position. Then we are having its drive position like half kneeling, kneel sitting, prone kneeling and drive prone kneeling. In sitting, usually the position is taken on stool or chair. Thighs are supported, hip knee flexed, knees are sufficiently apart and the feet rest on the floor and heel. Usually the hip flexors work to maintain the right angle of the hip joint to prevent the tendency to slump. The muscle work of rest of the body is the same as in stand. Usually comfortable and stable position. Those who cannot maintain the position in standing, they can adapt this position, and lateral and rotatory movement can be localized to spine, and localized knee and foot exercises performed usually in this position. The right position, there is straight sitting, right sitting, crook sitting, long sitting, cross sitting, side sitting, high sitting, stoop sitting and fallout sitting. Then next we are having the lying position, which is the easiest position, and muscle work is done by the head rotators, hip flexor extensors and medial rotators of hip, and usually static posture training can be done, and usually it is advantageous in case of spinal deformity, but breathing is retarded and it also hinders the return of blood from head, and so it could be unstable for elderly and those who are suffering from high BP. And crook lying with pelvis lift, half lying, full lying, leg prone lying, side lying, sit lying, eye to eye positions. Then we have hanging, which is suspended by grasping over the horizontal bar. Forearm pronated, arms straight at least shoulder width apart. Head is held high, scapula down, trunk, leg, hands straight, and ankle plantar flexed. So usually the flexor of fingers working strongly, and muscles around the wrist, flexor of elbow, adductors of shoulder, depressor, retractor, medial rotator of scapulae. They are going to fix the scapular base upper back. And the posterior neck muscles, lumbar spine, flexors, hip extensors, they correct the tendency to arch the back as a result of overaction of latissimus dorsi. The hip adductors to keep the legs together, extensors of the knee may work to maintain the full extension, and plantar flexors work to point the toes on the floor. So basically, it is suitable in whom strength and body weight are well balanced. Usually thorax is fixed in inspiratory position, so sometimes breathing could be difficult, and those who are suffering from cardiac respiratory condition, it is not suitable for them. There is a derived position, that is wall hanging. Thank you.